Hello, my name is Kathleen Peng. I'm a nursing student at the University of Michigan. I have completed clinical at the Beach Unit at the Heartland Healthcare Center in Ann Arbor, and I am reporting on a patient. Background data. The patient is a 52-year-old divorced Caucasian male. He has been at Heartland for 5 years, and he used to work in construction. However, he currently has no occupation. A doctor comes into Heartland once a month for checkups as his usual medical care. Vital signs. The patient's pulse was 86, blood pressure 124/70, and respiratory rate was 18. Chief complaint. Patient complains of pain and limited mobility due to his multiple sclerosis. History of present illness. Patient was first diagnosed with MS at 18 years old. Patient rates pain of 4 and 5 out of 10 in his left side and lower extremities. He says the pain comes and goes throughout the day and becomes worse with movement. Patient finds rest to alleviate the pain and discomfort. Patient is confined to an automatic wheelchair and exhibits very minimal movement and cannot perform most daily activities that he used to. He sometimes uses 1-pound weights in his right hand for exercise and sometimes attends physical therapy at Heartland Healthcare. He needs assistance with most activities. He can move from room to room in his wheelchair because of the automatic remote control. Patient reports feeling very depressed and says he misses walking, running, and riding my motorcycle. Health history. Patient has history of multiple sclerosis, multiple UTIs, renal, hypertension, depression, insomnia, migraines, peptic ulcer disease, MRSA-C diff colitis, cholangitis, mitral valve disease, and dementia. Immunizations. Patient is up to date with all immunizations and receives the flu vaccine annually. Allergies. Patient is allergic to Zysin and he develops hives as a reaction. He is also allergic to tape and his reaction is redness. He is also allergic to triad but with no reported reaction. Past hospitalizations and surgeries. Patient has been hospitalized for a mitral valve replacement and a stage 3 pressure ulcer. He had a seizure on December 24, 2014. A suprapubic catheter was also inserted recently. Medications. Alendronate, also known as Fosamax, takes 70 milligrams by mouth weekly on Tuesday. Aspirin, 81 milligrams by mouth once a day. Baclofen, 20 milligrams by mouth every 6 hours as needed for muscle spasms. Next, Dulcolax, 10 milligrams at bedtime. He also takes vitamin D3, 2,000 units by mouth once a day. Citalopram takes 30 milligrams by mouth once a day. Colace, 100 milligrams by mouth once a day. Neurontin, 600 milligrams by mouth 4 times a day. Levetiracetam, 250 milligrams oral tablets. He takes 3 tablets by mouth every 12 hours. Lisinopril takes 1 tab by mouth once a day. Mirtazapine, 15 milligrams by mouth at bedtime. Morphine, 30 milligrams by mouth every hour as needed for pain. Also takes a multivitamin with minerals, 1 tablet by mouth once a day. Senelax, 8.6 milligrams by mouth at bedtime as needed for constipation. Temazepam, 30 milligrams by mouth at bedtime as needed for insomnia. Xanaflex, 4 milligrams by mouth every 6 hours for multiple sclerosis. Functional assessment. Patient reports no use of alcohol or illicit drug use. Patient was a former smoker from the ages of 12 to 45, smoking 1.5 to 2 packs per day. Patient attempts at a normal sleeping pattern. However, he has difficulty sleeping at night. He takes frequent short naps throughout the day. Patient drinks coffee daily, and he cannot exercise due to his limited mobility, and he uses a remote wheelchair. Psychosocial data. Patient dropped out of high school to join the Air Force. However, he went back and got his GED only to find out he has multiple sclerosis and was dismissed from the Air Force after completing his GED. Patient practices Catholicism and goes to Mass when it is offered at Heartland. Patient reports no relationship with his 3 kids and ex-wives. He has no communication with relatives besides his sister and brother-in-law, who visit him frequently. Patient is not in a current relationship, but he is stressed about not being able to meet anyone and about finding a job after hopefully leaving Heartland. Family history. Patient denies family history of cancer, heart disease, hypertension, HLD, or other neurological and autoimmune diseases. However, the patient's father had a stroke in his 50s and his sister has had past seizures. Assessments. I performed the musculoskeletal assessment and neurological assessment because of the patient's multiple sclerosis. Review of systems, musculoskeletal system. Patient has severe limitation in performing daily activities. He has limited mobility and cannot move around besides moving from room to room in his wheelchair. Patient reports no arthritis or family history of arthritis. Patient denies inflammation or warmth in joints. Patient rates a 4 or 5 out of 10 on the pain scale and increases with movements, he says. He finds relief with rest and is taking medications prescribed by the doctor for pain and multiple sclerosis. Patient reports feeling the best at night before falling asleep. He takes 2 sleeping pills. Patient has been having symptoms of multiple sclerosis since he was 18 years old. He is currently 52 and is not satisfied with the result of him being in Heartland Healthcare Center. Patient complains of not being able to move and does not get much help for his discomfort. Patient denies using herbal remedies. Patient does not show concerns about his diet, and he says he's eating enough protein and calcium. However, he does not like the food offered at Heartland very much. Patient cannot exercise or move. He becomes upset and says he misses walking and riding his motorcycle. Patient denies ever having broken a bone. Physical exam, musculoskeletal. Due to the patient's multiple sclerosis, I performed the musculoskeletal exam. From inspection, the patient has symmetric bone structure. However, his left side is slightly thinner than the right. Posture and gait were unable to be assessed due to the patient's confinement to a wheelchair. No signs of scoliosis, but patient sat with right shoulder slightly raised due to comfort. From inspection and palpation of the joints, there was no erythema found, or inflammation or swelling. Patient exhibited full range of motion in the TMJ. The neck could not fully flex laterally or hyperextend. Only right upper extremities could be assessed for the rest of the assessment. The right shoulder was able to elevate and depress. The right elbow, wrist, and fingers had full range of motion. The middle index fingers on the left hand, however, showed slight extension. The lower extremities could not be assessed. Patient was graded 5 out of 5 for muscle strength in the right deltoid, the right bicep, tricep, wrist, and fingers. Left bicep, deltoid, tricep, wrist, and fingers were graded a 1. The bilaterally lower extremities could not be assessed. Review of systems for the neurological system. Patient reports no stress, but is anxious about being able to find a job if he leaves Heartland. Patient denies denies high blood pressure, never had a stroke either. First seizure, however, he had on December 24, 2014. He denies any back injuries and denies having Lyme disease, meningitis, or diagnosis of Alzheimer's, Huntington's, and Parkinson's disease. Patient denies any family history of those, however, he understands he is diagnosed with multiple sclerosis. The patient wears glasses for reading. He feels tingling when stretching and numbness all the time in his lower extremities. Patient is forgetful and has trouble concentrating. He suffers from insomnia. Patient has no past head injuries. Physical assessment of the neurological system. Patient received a 22 on the mini mental state exam and was drowsy during the assessment. His orientation was ×3 and knew person, place, and time. His facial expressions and speech patterns were normal, and he had full registration and could repeat back blue shirt, hat immediately after I asked. He answered 2 wrong on the serial 7s question and missed 1 object when asked to recall for the memory test. Patient was able to name a pencil and watch when asked, and repeated no ifs, ands, or buts normally. Patient could follow a 3-stage command and could read a follow command as well. Patient was able to write a logical sentence and could copy the design, having 5 points and the shapes intersecting. Patient showed normal abstract reasoning, judgment, and thought processes. He was unable to perform general motor functions or the Romberg test or lower extremity fine motor functions. Patient exhibits full fine motor skills in the upper extremities and can detect light touch in upper extremities. However, he was inconsistent in detecting when I performed on the legs. There was inconsistency of detection of sharp or dull pain over the arms and legs. Patient would report sensation when I wasn't touching him at all. Patient started to fall asleep during the assessment, however, would wake with gentle stirring. Patient could feel vibrations with tuning fork in the right and left hands, but barely could feel them in the right and left toes. I performed sterignosis, and the patient could tell I had placed a paperclip and tube in his hands. The Babinski reflex was negative, and I was unable to perform the ankylosing because the patient could not dorsal flex. In addition to the musculoskeletal and neurological examinations, I would assess the gyno-urinary and peripheral vascular system. According to the Journal of Urology, it is important to assess the gyno-urinary system when diagnosed with a neurological disorder because of the possibilities of developing lower urinary tract symptoms. The authors performed a study looking for possible factors that determine the final symptomatic experience with patients with lower urinary tract symptoms. They concluded that the autonomic system can lead to obstruction and poor muscular contraction of the bladder and its ability to empty, becoming a major determinant for the onset and severity of developing UTIs. Patients with MS have a neurological disorder that affects their ability to urinate, and so it is not uncommon for them to have catheters inserted. The patient in my exam has had several UTIs since the onset of his MS and is currently using a catheter and having daily checks with his gyno-urinary system to prevent the development of further UTIs. According to thrombosis research and findings, it is important to assess the peripheral vascular system in patients with musculoskeletal disorders. Because MS often causes weakening of the musculoskeletal system and the progressive loss of mobility causes patients to become wheelchair-bound and have a risk of developing deep venous thrombosis. Paralysis can lead to edema, which is frequently found in the lower extremities of MS patients. My patient showed slight edema in the legs, with skin being smooth, pale, with little hair. The pulses were graded 0-1 in the lower extremities, and so monitoring the peripheral vascular system, especially in the lower extremities, is important to prescribe complete proper care for a patient with multiple sclerosis.